this, and we will showcase for you a wonderful super specialist preventive bonanza today, in which often you have heard these super specialists talking about the disease, its treatment, various aspects, complications. Today we will be talking about how to prevent the disease itself. So we were supposed to be opening with Dr. Kumar, but Dr. Prashant Saxena has requested that he has certain important appointments, and therefore we would start with him. Dr. Prashant Saxena has been our friend now for a very long time. Throughout the COVID period, he was our COVID teacher, covering various aspects of COVID, right from the virus to the pathophysiology, to the complications, to vaccines, to long COVID, fibrosis, etc., etc. Today he is a new role. The new role is how to prevent various respiratory diseases. To introduce Dr. Prashant Saxena, he is at present Director and Head of Pulmonology and Sleep Medicine, Associate Director Critical Care at Max Smart Super Specialty Hospital. His key area of expertise includes interventional pulmonology, intensive care and sleep medicine. He has undergone fellowship training in West Met and Liverpool Hospital, Sydney, Australia. Due to his interest in infection control, he has developed simple but effective infection prevention bundle protocols which have significantly reduced hospital-acquired infections. He has also developed and implemented antibiotics stewardship programs in order to prevent re-emergence of antibiotics resistance and decrease preventable hospital-associated infections and cost of treatment. He has also introduced the concept of rapid response team for patients in order to decrease the number of unexpected events in the hospital. He has many publications and presentations to his credit. He is a teacher for IDCCM, which means Indian Diploma in Critical Care, and teacher and supervisor for MRCP UK. He is actively involved in organizing community health programs, CMEs, workshops and health awareness talks both for patients and doctors. He has immensely contributed to the management of COVID patients in this epidemic, and I have already alluded that he was our COVID teacher in the last 2 years. He has multiple awards to his credit. Without taking any more time, I give it to Dr. Prashant Saxena to start his talk on preventive pulmonology.
Thank you, sir, and thank you for a very elaborate introduction. And I got a call from Dr. Chauhan a few days back, and he asked me that there is an event and we would like to speak, you to speak. And I asked him, okay, what's the topic? And he told me preventive pulmonology. So even I had to think, how would I put up my thoughts when I would be making such a presentation, and I immediately accepted it, because this is the most important aspect of today's era, where we should talk about prevention rather than cure. And lungs are one of the most important organs of the body, and needless to say, we have just recovered or are recovering from a COVID epidemic. And why it is important? Because our body needs oxygen, and every day we need about 420 liters of oxygen for the body to survive and do the human functioning. And for that we almost breathe about 10,000 liters of air in a day, which means that it is very important for the air to be clean and pure. But is it a fact, or are we just breathing impure air? We know pollution affects the world. It is not unique to India. But about 7 million people die every year due to pollution-related health effects. We measure the pollution quality by this index, which is very common, the air quality index, where you measure the level of pollutants in the air, and it ranges from 0 to 500. And this is how it is measured. We are presently In Delhi, if you ask me, we are nearing 300 to 400 or maybe more, which means we have a very poor quality of air in the surroundings, which means that we are prone to develop major respiratory issues in our lifetime if pollution is there. Most of the pollution comes from these gases: carbon monoxide, sulfur dioxide, nitrogen dioxide, particulate matter and the ozone. All of these are liberated through the industrial waste and the cars which we are using. Along with it is the particulate matter which is there. Talking about ozone, we know ozone is protective. We used to read in our initial early childhood that ozone is a protective covering around the earth. So there are two coverings of ozone, which is around the earth, and there is another ozone which we generate through our automobiles and industries, which surrounds us, which surrounds the city. And ozone is a harmful gas. Ozone is toxic to the body, to the lungs. Almost every organ is damaged. All these things combine to form this smog which we see and which we are soon going to see once winters come. A layer of these particulate matter, noxious gases, ozone combined surrounding us. And this, along with the health effects of inhaling these toxic gases and fumes, there is a danger to the earth because we are surrounded by a blanket which prevents the heat from coming inside and which also prevents the heat from escaping out. Because the layer serves as a barrier which is leading to global warming and which is being evident nowadays. Suddenly you will see in the news there is everywhere flood going on. I never saw this amount of floods in the whole world. Sydney, South Africa, Americas, India, everywhere there is a flood. From where this water is coming? This water is coming from the glaciers. The glaciers are melting and the water is coming from the glaciers. Then acid rain, another important entity. Whenever you are outside and there is a rain, these gases combine with water to form acid. And this acid can burn your skin, can burn your hairs. The people who are very sensitive, that's why we say कि पहली एक दो जब बारिश होती है तो then don't go out, don't get wet. एक दो बारिश हो जाने दो, फिर नहा लेना. So this is very common nowadays. We have so much pollution. Anytime it rains and you are wet and your whole skin is getting eroded because of this. Indoor air pollution is another important factor, especially in Indian households, where we are using agarbattis, dhoop battis, havans. All these things are very common in our houses, but we don't know these are major pollutants. And diseases, we all know asthma, COPD, lung cancers, pneumonias, birth defects, stillbirth, premature birth, miscarriages, all these are common in people who are exposed to pollution. And if we don't control this pollution, ultimately you can see it's like a pyramid and we are already just on the second step. We are already seeing a lot of emergency visits. Nowadays in our hospitals we see the moment the pollution will increase, you will see the emergencies flooded with people who are coughing, who have pneumonias, who are coming with breathing problems, and you don't even have bed to admit these patients. And we are living in this phase now. And if we don't control this, we soon will be having deaths. Already we are having deaths, but it will increase to a mammoth level. So what can you do? The simple things we can use now. The e-bikes are common. The electronic cars are there, carpooling, pollution check of your cars. Use the public modes of transport. Not many of us are very keen in doing that. But ultimately the time will come. Because of the increasing number of vehicles and the pollution, you will have to do this. Talking about the measures to restrain the progression of lung diseases due to air pollution. Most important thing is the regular health checkup. Now, regular health checkup is not recommended for everyone. It is for people who are susceptible. For example, Not all smokers develop COPD. Not all people exposed to pollution will develop a lung disease, but some people will. And those who are symptomatic, they should see the doctor. The mask should be worn, N95 mask, I will come to this, and vaccines. So PM 2.5 is something which we all should know. PM 2.5 means particulate matter of 2.5 nanometer diameter or less. And this is the particle which is about 3% the diameter of the human hair. So you can imagine how small this particle is. And once you inhale this particle, it will go inside your alveoli. It can get absorbed into the blood circulation and can get deposited into the body through the blood. And slowly it will cause toxic damage to the body. N95 means a mask which filters 95% of these 2.5 micrometer particles. And N99 means it will filter out the 99% of the particles. But please remember that your mask will not filter out the toxic gases. Mask will only prevent against the particulate matter. The problem with the mask is that we don't wear the mask properly. The mask never fits us. There are two tests which you can do. Once you apply the mask, you can do a negative pressure check and a positive pressure check. Means you wear the mask, hold it and take a deep breath inside. If the mask sticks to you, it means there is no leak. And then there is a positive pressure check. You blow slightly and the mask will blow. There will be no leak. You can check the mask. But not often we do this. And another important thing about the mask is that you must know that all the N95 masks which are available nowadays, they last for 8 to 12 hours of continuous usage. Which means if a doctor like me is wearing a mask, I have to throw the mask every day. I cannot use it beyond one day. Because it is ineffective, because the pores will get blocked. And once the pores are blocked, the air will enter through the sides of the mask and you will ultimately inhale the same air which everybody else is breathing. So please remember, if you are using an N95 mask, it lasts for a day. Smoking, another important problem nowadays, and millions of people die. Most important thing is that India is the hub of these 5 major diseases, and these 5 diseases combined are the #1 cause of death in the world, which include lung cancer, COPD, asthma, exacerbations, pneumonia, coronary artery disease and stroke. If you combine the mortality of these all 5, these are the #1 causes of death. And all of these, the most important risk factor is smoking. So, smoking is something which we have to address apart from counseling. See, the most important point is that if you are willing to quit, you can quit. And this is the data which is there from the US, that even in high school kids who are more exposed, almost 50% of these kids were able to quit smoking after counseling and visiting the doctor. And then we have the de-addiction. We can help you, we can counsel you by providing you these various things. But everybody knows about nicotine patches, nicotine chewing gums, lozenges, inhalers. But you have to understand all of this has to be prescribed after calculating the amount of smoke or the nicotine one consumes. You cannot blindly give a nicotine chewing gum or inhaler to anybody, because nicotine is a harmful substance. If you give a higher dose, the person may have side effects. Talking about vaccines, we know about flu vaccine. It is given every year and it takes about 2 weeks for the immunity to develop. So usually we give it in end of September because the flu season begins in October. And it can be given to all the individuals. It is given to everybody. More than 6 months you can give to anyone. The pneumococcal vaccine is another vaccine which we give for the population, and the recommendation is it has to be given for all babies and children younger than 2 years old and all adults more than 65-year-old. Between 2 to 64 years of old age group, we have to find out high-risk people people who have the chronic diseases like CKD, CLD, diabetes, immunosuppressed, steroids, all these people have to be vaccinated with the pneumococcal vaccine. The guidelines have changed now. The recent recommendation is to give the pneumococcal 20-valent pneumococcal vaccine. Now this is available now. It is coming up in India. But if you don't have the pneumococcal 20-valent vaccine, you have to use 2. You have to give PCV 15 followed by the polysaccharide vaccine after 1 year. But if you have a high-risk patient who is immunocompromised, you can reduce the interval to 8 weeks. So far we are using PCV 13, which is Prevnar. But these two are available now. So even if you are using Prevnar, you can use Prevnar followed by the pneumococcal vaccine after 1 year. The polysaccharide vaccine. Coming to PFTs, many people ask me, when do you do PFT, should we do? Many people come to our hospital, कि हमारी PFT कर दो, ब्रोंकोस्कोपी कर दो, एक्सरे कर दो, लंग क्लीन कर दो. शाहरुख खान ने लंग क्लीन कराया है. So when I tell them, no, there is no role. PFT is only as a tool to find out if you are having a burden of a disease. So if you are a smoker, you are having symptoms, I will do your PFT. If you are a person living in a polluted area, I will do your PFT if you have symptoms. But otherwise, if you are fit and fine, I don't need to. Because that will tell me that you have a disease. Because, mind you, pollution-related lung disease and smoking-related lung disease, even if you stop the exposure, they continue. So, we have to understand, we have to identify these people. So, PFT we do in these high-risk groups. No role of routine X-ray. Don't do X-ray just to find out what is happening to your lungs. Do I need an air purifier? Now this is a question which is very important. Everybody asks. These are not expensive. These are expensive modalities because air purifiers have become like starting from Maruti to Mercedes, and they're very expensive and all the technology. People are confused what to use, what not to. But for general idea, I will tell you my criteria of prescribing an air purifier. If you have a person who develops sneezing or shortness of breath at home, which means there is a proper problem at home, there is exposure at home, that is the criteria. If you are allergic to dust, some people have a dust mite allergy. Carpet clean हो रहा है, छींकें आ रही हैं, पर्दे साफ कर रहे हैं, छींकें आ रही हैं. So that is a dust mite. You have to use an air purifier. You are living in a very polluted area. Unfortunately, we are in Delhi like that. So, people who are susceptible, people who are in metros, they come home, they are short of breath, they are coughing, कि बाहर जाता हूँ तो खांसी होती रहती है, then at least at home you can use that. People who are suffering from COPD asthma, who get a trigger, immediately they are exposed to this. Sometimes you have pets. Air purifiers are effective in removing pet dander also. So people who have allergy to pets also, we can use air purifiers. Then there are people who are allergic to varnish, disinfectant. घर में पेंट हुआ, घर में कुछ हुआ, स्मेल आई, किसी ने डिओड्रेंट लगा दिया. So please remember that volatile organic compounds can be filtered by a air purifier. So it is also effective in these people. So I would summarize my talk. I know there are other speakers also. I would suggest that the best way to prevent lung ailments is that we start carpooling from today. Electric cars will come a big way, I am telling you. Electric bikes are coming up, and I will not be surprised if after 5 years we all are using electric vehicles. Public transport is another way. If you want to use public transport, please use it. Havan. And to my surprise, I found out there is a smokeless Havan Samagri also available. So please, if you are doing Havans in your house, use the smokeless one. We know that crackers have been banned, smokeless crackers are available, but Havan is also something which we should look at. Health checkup for susceptible individuals. Not everybody needs to panic and go to doctors. If you have a problem, if you are coughing, sneezing, having breathing problems, chest pain, just go to the doctor and understand what is happening to you. Get vaccinated only after consulting your doctor. Don't just get a vaccine from a chemist and get yourself vaccinated. It is not advisable. Say no to tobacco. Tobacco is something one must avoid. You can quit smoking it is a fact. I have seen thousands of people who have quitted smoking. There's a data, everybody knows them. I have my patients also who have quitted smoking. N95 mask will prevent you against particulate matter but not against gases. So if you are out in a smoky environment, don't think that I am protected. You need a different mask for it. And then finally, we have a coordinated community effort. The community has to join hands. Stop burning parali, stop burning your garbage outside the houses. All this has to be done. Electric crematorium is something which we have to understand, and public is aware of this. So finally, it's all about a coordinated effort, which not only prevents your lungs, but also prevents your heart. Thank you.
You told us, you are asking me what to speak on preventive pulmonology. I think we are speechless after your presentation. Wonderful presentation. Dr. Lalit, I think you want to ask something.
So I just want to know, you talked about pulmonary function test is not required for everyone. It's here for the
Yes. So, why it is part of the preventive health checkup is that some people have, we are a community where we sometimes tend to underscore our symptoms. If you are having breathlessness, you will attribute that I am aging now. If you are having a slight cough, हो सकता है कुछ खा लिया होगा. But these are checkups which will tell you if you have an early problem. So that's why PFT is a part of the health checkup.
It should be there.
Yeah.
Very much, Dr. Prashant. I would like Dr. B.K. Gupta, sir, President of the Forum, to felicitate Dr. Prashant Saxena.